Welcome to our In Focus discussion tonight on July's pandemic update. With the daily swing of COVID stories sometimes overwhelming us, we'd like to take a monthly step back and look at the broader picture when it comes to the pandemic. We want to talk about the things that you may have heard about and maybe some things that you haven't. Kicking off our conversation tonight is Erin Klaus, the Strategic Engagement Manager for University of Utah Health. And Erin, it's good to see you. Welcome back to the show.
Thanks for having me, Rosie.
Erin, we are seeing a spike in cases across the country and here in Utah. More than 1,000 new cases Thursday and 1,200 today. What are you seeing and what does this spike look like compared to others in the past year?
Yeah, that's a great question. Thank you. So what I've seen in the last few weeks is a spike in cases, just like you said. Compared to last year, we saw a very similar case count than we're seeing today, the same that we're seeing today. The difference today is that we're seeing really increased hospitalizations. So on the screen and the charts, on the left, you'll see cases, and you can see compared to last year is very similar. On the right are hospitalizations, and that's 63% higher than it was last year at the same time.
It's like deja vu, but worse. Can you break down the positive cases any further as far as where they are and what age groups they're in?
Yeah, so we're seeing a pretty even spread in the age groups right now. The two boxes are the lines that are circled are comparing last year to this year, and you can see very similar peaks that we saw in July of last year. And you also see the same spread in cases. The difference this year is the 25 to 44-year-old individuals actually have a higher rate than last year's 15 to 24-year-olds.
And we can tell that vaccinations really are making the difference in the differences that we're seeing in the age groups. And we're seeing some breakthrough cases, some people who are vaccinated who are still getting COVID. Can you talk about the significance of vaccines?
Sure. In front of us here we have a chart that just breaks down cases in vaccinated individuals and unvaccinated individuals. And you can see the line on the top shows us the unvaccinated individuals, and they have a rate about 4.5 times higher than the vaccinated individuals. Now, vaccinated individuals are getting COVID, and about 15% of our daily cases are in vaccinated people.
Do you have any numbers that show how mask mandates, when they were in use, affected these numbers?
Absolutely. When we don't give this virus an opportunity to spread to the next individual, and masks are our very best weapon besides vaccinations, we see fewer cases, period. We just aren't spreading it as much when we wear our masks properly. And you can see here last year, when the mask mandate started in Salt Lake County, the blue line on the bottom, you can see the cases in Salt Lake County came down much quicker than the rest of the state.
Let's talk about not having mask mandates for schools. What happened last year when there were mandates, and how do you feel or what are you seeing about it now?
So this is a really important topic. Last year, we had children at home, and when they were in school, they were wearing masks. And we still saw children becoming ill with COVID. Kids can get COVID. Kids can get sick from this virus. This chart shows us the peaks that we saw last year from 1 to 14-year-old children, our school-age children. This year, we are basically sending our children to school with virtually no protection. They are not eligible for the vaccine, and we're saying there's no mask mandate. Regardless if there's a mask mandate, I'm urging all parents to send your children to school with a mask on. They are inside. We know this virus is airborne. It will spread in closed environments. Put masks on your children and vaccinate them as soon as the vaccine is available.
And this is why experts are so fearful as we're heading into back to school season.
Yes.
Erin, what are you seeing with vaccination rates? Has there been an uptick since this surge has been happening?
Yeah, that's a great question, and I looked more closely at that today. This chart shows us the age groups and how complete they are at their vaccination. The bigger the green bar, the bigger the portion of that population that's been vaccinated, fully vaccinated. They've received both of their shots or one of the Johnson & Johnson. Now, as you can see, the older age groups are almost all the way vaccinated, greater than 80%. They look great. And as the ages are younger, they've had less time to receive the vaccination, and the percentage of completion isn't as high. As I looked at the rates over time, I have seen an uptick in vaccinations in the last week to 10 days. What that tells me is individuals who were scared, and it's okay to be scared of the vaccination and have concerns, go talk to your healthcare provider. It's showing me that people are understanding that their risk in getting COVID is higher than the risk in vaccination. If you have concerns about the vaccination, reach out to your healthcare provider. You have a choice whether or not to get it, but I urge you, please, to talk to your provider and talk to them about your concerns.
Thank you so much, Erin, for illustrating. We hear all these numbers and data that are ever changing, and sometimes it's overwhelming, and it helps to be able to see it visually. And we have some time for final thoughts. We've gone through all of those charts, the data. What would you like to leave our viewers with tonight? I know you had a lot of great tips and advice. What are you looking ahead to, maybe, or what are your parting words with our viewers?
Yeah, thank you. So I guess I'd like to speak directly to individuals who are unvaccinated right now. If you choose to get vaccinated tomorrow, that vaccine won't help completely until you're fully vaccinated plus 2 weeks. That's 5 to 6 weeks with the shots that take 2. Until then, until you can speak to your provider and talk to them about your concerns and receive your vaccine, I urge you to wear your mask. The masks are what are going to protect you right now and protect everyone else. Additionally, if you are vaccinated, wear your mask. The CDC came out today with a report that shows that vaccinated individuals can get the virus and spread the virus. The difference is vaccinated individuals do not suffer the severe disease and deaths at the same rate as unvaccinated individuals. So please talk to your providers, wear your masks. We are back in this. Things have changed. It's time to mask up, get your vaccination, and social distance again.
You've been hearing from Erin Klaus, the Strategic Engagement Manager for University of Utah Health. And Erin, thank you so much for your insight. We appreciate your time.
Thanks for having me.
We'll be right back. Thanks for staying with us for our In Focus discussion tonight on our July pandemic update. For our next segment, we wanted to get into vaccines and mask requirements. Joining us next is Professor Tennille Brown from the S.J. Quinney College of Law at the University of Utah. And Professor, thanks for joining us tonight.
Thanks for having me.
Let's start by talking about vaccination requirements in general. When did vaccinations become commonplace and for what reasons?
Yeah, so surprisingly, the first vaccine mandates were actually well before the Civil War in Massachusetts in response to a smallpox pandemic. They then became much more common in the 1920s after World War I in response to the Spanish flu epidemic and other pandemics. So they're now in every single state. Every single state has a requirement that before you enter public school, you need to have certain vaccines. They vary between states, and the exemptions also vary between states. But they are really most effective when they're preventing outbreaks. So vaccines are not treatments. These are really meant to be preventative, but they are super common, and it's not unusual for there to be pushback to these vaccine mandates. But every single state has something for school. We've seen vaccine mandates for hospital staff and physicians. They need to get the flu vaccine and the MMR and the DTaP in order to work in the hospital. So we have a really long history of vaccine mandates in this country.
And unfortunately, history is continuing to repeat itself. How could a requirement for the COVID-19 vaccines be made, whether through air travel, public schools, or what about state laws?
Yeah, so it really depends on which venue is being targeted for the vaccine. So when the federal government is acting as an employer, they can mandate vaccines or masks. So that's in the VA and all of the federal agencies, on trains and planes. But they can't go so far as to mandate vaccines, across the board. That's something that the states really regulate. So states are well within their constitutional authority to mandate vaccines or masks. We've seen some states already doing this. So states can do it, local governments can do it. They're on very firm ground constitutionally.
That's very fascinating. And we're seeing vaccine requirements in businesses like hospitals and universities, like you said. Is that a better way, and can these laws help or hurt these attempts?
Yeah, so I think they really work together in tandem. I don't think we need to have one or the other. I think when there are mandates, it really sends a strong message of support that may encourage some people who are on the fence who maybe aren't even subject to that mandate. If they know that the hospital staff are mandating it, then that's a really clear signal that this is something that on balance is effective and safe. But I think that we don't need to choose one or the other. I think that these laws can really reinforce each other. The businesses stepping in where maybe governments have not required mandates, that's really helpful too, because people have all sorts of reasons for being hesitant to getting the vaccine. And so any way we can try to encourage the vaccines, I think let's do it. If that's bribes, if that's incentives, if that's mandates, I think we're at a point now where anything we can do to really increase vaccines is worthwhile.
Professor, how are mask requirements different legally?
Yeah, so in Utah they're different because we have a state law that prohibits the use of masks in public schools and higher education unless there's an emergency or unless you are then consulting with your public health authorities. But the default is you can't have mask mandates. We don't have that sort of prohibition on vaccines. So they're treated a little differently under state law, but constitutionally speaking, they're treated very similarly. These are both inconveniences or things that can kind of infringe on your civil liberties, but that really are effective and promote the public health. So they are treated similarly constitutionally speaking, but under state law, they're treated a little bit differently.
So going off of that, the discussions around vaccines and mask requirements usually involve civil liberties and choice. What do you make of these arguments?
I'm so glad you asked me that because I've done a number of these interviews around constitutionality of mask mandates or vaccine mandates. And I have to say that while civil liberties are incredibly important and we do not want to be trampling on people's civil liberties, I think we've taken a pretty myopic view of civil liberties in the last year and a half. Historically, civil liberties have meant protecting everybody's civil liberties and not just protecting those who are the loudest or those who are maybe being maybe a little bit of bullies with their civil liberties. The idea of civil liberties is everyone's civil liberties matter. So let's think really broadly about this. Take a really big picture view of civil liberties here. So if you are choosing not to get the vaccine, whose civil liberties are you impacting? You're impacting the nurses who are short-staffed and who have been working a year and a half on very little energy. You're impacting people who are paying higher insurance premiums because of the ICU admissions being at about 80% capacity for the last year and a half. You're impacting people who are immunocompromised and who can't go safely see their doctor. You're impacting businesses who don't know if they're going to be able to stay afloat because if we go back into a lockdown, they're not going to be able to keep their businesses running. And so I just think we've taken a very narrow look at civil liberties, and we need to remember that historically, in these cases where we have public health crises, there's always a trade-off between civil liberties and the public health. And there are lots of things that we can't do because of safety concerns, right? We can't impose risks on other people just because it's our civil liberties. We can't eat peanut butter sandwiches, even though our kids might really like peanut butter sandwiches. If that means that someone else's kids at school could die, well, then it's very clear we don't send our kid to school with peanut butter sandwiches. You can't drive drunk. I mean, there's so many examples of things where you might try to make an argument for your civil liberties, but there's always a trade-off of needing to protect the bigger picture public health.
Yes, yes, and yes. Thank you so much for putting this in perspective. I don't know if we need to use analogies or whatnot to get folks to understand here, like the message that we're trying to drive home. You've been hearing from Professor Tennille Brown from the S.J. Quinney College of Law at the University of Utah. Thank you so much for being part of our conversation tonight. It was great to have you.
Thank you, Rosie.
We'll be right back. Welcome to our third and final In Focus discussion on our July pandemic update. Finally, we'd like to talk about the science of COVID-19 and politicizing that science. Rounding out our conversation tonight is Dr. Nels Elde, evolutionary geneticist from the University of Utah. And Doc, welcome back to the show. We always appreciate your time.
Well, thanks, Rosie. It's so nice to be back tonight.
How do the science research papers talk about how the pandemic ends up being used for political means?
Yeah, so it's not new that science and politics are sort of colliding in ways that's been going on for decades. But I think what's a little bit different here is, we're taking an active pandemic, which is having a massive impact on public health, as we've been hearing about on tonight's show. And then this is colliding with some political agendas in ways that, brings me out to want to talk about this, because I'm worried that some of this politics is potentially interfering with science moving forward. And I think that's a conversation we should be having.
Now, there has been a question of whether COVID-19 came from a lab, and scientists are looking into that idea. What are they finding?
Yeah, so this is obviously a really supercharged issue. Where did the virus come from? We all want to know that, and scientists want to know that. As soon as the first sequence a year ago, January, was available, scientists started poring over this to try to understand, what is this thing, what's going on here? And so you had sort of two parallel paths unfolding. The first was a lot of energy to make the vaccine, to design that, which has been a medical breakthrough, probably of our generation. There's also been evolutionary geneticists like me, my colleagues, who are really curious sort of about the family tree of the virus. So where did this come from? And so we're starting to, at least in rough outlines, put a picture together. And the evidence so far is really pointing to the idea that this is a natural virus from the environment, that it probably spilled over from an animal reservoir to humans at some point in late 2019.
Can you tell us about some of the research papers that you have been looking at? And I know the first was the sampling of coronaviruses in Southeast Asia that shows that SARS-CoV-2 most likely came from the wild.
Yeah, that's right, Rosie. And so before this pandemic, coronaviruses, which SARS-2 is a representative of that collection of viruses, not really well studied, it turns out. So, I think we've heard of SARS before. You might have heard of MERS, which kind of bubbled up 10 years ago. But even before SARS-2 happened, not that many labs studying coronaviruses, not that many evolutionists studying it. And so this paper and some others like it have started to go out to the wild, collect these samples, and start to put together that family tree. And so that's exactly what we're beginning to see as a picture where it makes a lot of sense. You can start drawing, almost connecting the dots from wildlife reservoirs to what the virus looks like, and the virus that we saw originally, and it continues to change as we're seeing with the new variants cropping up from time to time.
And there was another paper that traced COVID cases back to potentially farther than Wuhan using statistical methods. What can you tell us about that?
Yeah, so this is important too, especially as we think about kind of the politics, again, colliding or some of the conversations potentially going off the rails here. And the thing here is, so to try to use these comparisons, the more of these virus sort of relatives that we can find, to do analysis on the timing of when this virus actually spilled over, when it emerged. And so there's several different approaches like this that are coming up with the same answer. Basically, we think sometime around November 2019 is when this virus emerged. And this ends up being important because we're hearing a lot of political sort of conversations that sort of bend the truth in some cases about the timing of this. And so this is where the science can actually come in and say, well, actually, here's the evidence, and let's at least agree on some facts as we kind of step through the conversation to try to understand this and learn from this experience.
So Dr. Eldy, what can we do, or what can be done to slow the cherry picking and misinterpretation of science?
Yeah, so there's always going to be cherry picking, but the science is the science. And so, I think tonight's show is a great illustration of what we can do. So I was, sitting here learning in the first two segments as we were stepping through those charts together to try to understand, how does this current surge compare to the last surge, or how do we think about that? Does wearing masks matter? There's a lot of hot air about that, but there's evidence too. And so we need to have those conversations. The legal implications, a lot of, again, loud voices who are making some points, but maybe a quieter conversation. In a lot of cases, scientists like myself maybe kind of hiding out in the laboratory, but I think we're realizing that, we're here for the conversation. We're coming out of the lab, and we want to go through the evidence together to try to come to a real understanding based on the science, based on the facts, and hopefully sidestep some of the political agendas that might not sort of be in the interest of public health.
Thank you so much, Doc. We have time for final words, 30 seconds left. What would you like to leave our viewers with tonight? Yeah,
so, I think it's that point, Rosie, that I was kind of just trying to make, is that I think, when we think about folks working at universities, oftentimes it can feel like there's sort of barriers there. Maybe we send our kids to the university, they learn for 4 years, but somehow, this is sort of walled off from the bigger conversation. I think we need to think about universities as, especially public universities, as public. The boundary of the university should be the boundary of the state, and that means we're all in this together. These conversations should be happening together. And if we do that, we might weigh some of our concerns or when it comes to getting vaccinated. And so not only to have that conversation with your doctor, but also to maybe talk to some scientists. What are they seeing? How do we really kind of have conversations as a community? I think we're really lucky living in Salt Lake in a community of this size where we can get together, we can sit down, we can have these conversations. And so maybe I would leave it with that, an invitation of let's do this together instead of alone.
Well said. I like how we ended that. You've been hearing from Dr. Nels Elde, evolutionary geneticist from the University of Utah. And Doc, thank you for participating in this conversation with us and for spending your Friday evening with us.
Thank you, Rosie. Keep it going.
And don't forget, we'd love to hear from you about the show. We invite you to join our Facebook group by searching for ABC4 In Focus, or you can send us an email, infocus@abc4.com.